work I see a lot of women, but we've actually seen a lot of men as well. And kids. I use nutrition response testing, just a type of muscle testing. Allows me to identify the more common food irritants. And I can do it on any age, which is super great, and there's no blood draws, which patients like, kids like. Of course, there's some higher level of testing if we would ever need to do that, but I find that most people, if they take out the majority of the bad stuff, we can find a place they can manage that. And then on the other side of it, we do nutrition response testing. It allows us to identify different organ systems that might need some support. So while we're calming things down in the inflammatory world, we're also going to give them some good pieces to rebuild. And so that's what we do. And I'm excited to be here. I got to come to the first inaugural event. But it's exciting to meet people that are like-minded. So thank you.
I am Dr. Sonda Powell, and I am also a chiropractor, and I have actually referred to several of you in the room already, so nice to meet you, Dr. Asher. And I am that chiropractor that whenever it doesn't get better, I'm going to find somebody else, that can, and usually I send people that he needs to do internal work to, because I can't get there, then I'm not going. And he's been great. So anyway, in my practice, I primarily see infants, pregnant women, and I see a lot of kids that are on the spectrum. A lot of kids that nobody knows what to do with. They might be autistic, they might have dyslexia, anything that, there's so many different things. I had a 12-year-old that came in the other day that weighs about 60 pounds and has been to numerous people. Looking at emotional support, looking at what's going on in their life, all of that, getting him under chiropractic care. Just diving in, but parents don't know where to look. And about 7-8 years ago, I had a kid that was diagnosed with PDD and OS, which is, that's a big word for can't control what he's needing to do, frequent outbursts and stuff like that. And so I sought out a doctor who, her name is Dr. Monica Berger. And so I have been working under Dr. Monica Berger for a long time. And she primarily takes kids that are autistic, that have, gut issues. They can't even function in their household, let alone trying to get them in a school. And we slowly start taking the inflammation off of their nervous system. So I have a lot of kids that can't, they're nonverbal. They don't know how to communicate with their parents. I actually did a house call last night because one of my autistic patients, her mom found blood in her ear, and she doesn't do well leaving anybody else. She comes and sees me once a week, rides in speaking and saying things. So I do that through chiropractic, through integration therapy. As far as I do know how to do integration therapy, and I prefer more to work with kids that are that low functioning, because a lot of therapists don't know what to do with them. So or they don't have the time to work with them. So I do that. I also work with parents and adults. My favorite is kids. And work with them on, like everybody else has said, with diet, nutrition. What can they do better? What's causing their tics? What's causing, these other issues? And sometimes it's neurological, and sometimes it's the fact that they have an underlying strep infection that they've had probably since they were in the NICU. Got to dig through and got to dig deep into those histories to find out what's going on with these kids. I see a lot of pregnant women. I'm Webster certified. I've been doing Webster technique since I was in school, so about 15, 16 years. And Webster technique is just balancing the pelvis, restoring balance to that uterus and that pregnant mom so that baby can get into the best possible position for birth. And so that technique works really well. And you know, done early. I really like moms to come and see me between 28 and 32 weeks. I really think that most OBs are not catching that these babies are not in the right position early, and we need that time. We need that time to get them in the right position, get their body, you know, it's amazing how many of these moms too are deficient in magnesium and other supplements, and you add that in as well as doing the adjustment, and next thing you know, that baby just moves and flips. So, you know, it's a whole component, and so I work in those areas, and then if it's something that I think they need more time or other skill, I'm really good about referring them out. I refer over to nutritional resources, you know, quite a bit over to Heather. Not that I just like Helen, but you know, and same thing to Dr. Asher. So I do like to take a more encompassing approach on what is happening with that patient and how can we help them. So it's nice to be here.
Thank you.
I needed this, and someone needs this, and someone needs. So I just see it as such an encouragement for you. Please be encouraged that we're all here, not only for them, for each other to just to be the whole body, the whole body. I mean, that was kind of that was a silly pun, but you see what I'm saying. So it's nice to hear that.
Just, you know, really overwhelmed a little bit, and just a little humbled to even be in the room. So I'm grateful that you all came in this evening. I'm thrilled to hear from each one of you and have a better idea of what you do in your practices. I just want to, you know, kind of sit like a sponge in the corner and listen to everybody and learn from everyone. So I think that we all have the ability to learn from each other. We all are doing very different things. I'm doing very different compared to what you all do, and you all do very different compared to what we do, but definitely I hear a lot about the gut, and the whole time I'm sitting here I'm thinking, well, the mouth is the entrance to all of that. And so we see a lot of issues with immune problems and what's going on in here that's then connected to what's going on with the gut. So I already see resources that, like, I need to talk to, you know. So I took notes the entire time. So thank you for being here. What I see us doing forward, I don't want to be the one that does all of the ideas, because I think we've got some really great thinkers in this room that are very creative. And one of the ideas, as I mentioned earlier, was having some sort of symposium where we did discuss things for patients to come in and get some education. That's a great idea. I love that idea, and I do want your ideas associated with that. But I kind of want to open the floor for any other ideas that you guys might have that you've developed, to just sitting here thinking, wouldn't it be really great if we did, you know, this, just to make this a productive time for all of us as well as for our patients.
This is really